joining us via telephone, registered nurse Twila Brase, president and co-founder of the Citizens Council for Health Reform. Twila, thanks for joining us by telephone today.
Oh, I'm so glad to be here. Thank you.
Now, Twila, we know healthcare is your thing. We don't expect a full legal dispensation, but can you unpack for us what is at stake in the Howbig v. Burwell case?
Yes, actually, the impact is potentially huge because what it says is that Howbig is challenging the IRS because the IRS decided that they could provide subsidies, premium subsidies for Obamacare through the federal exchange, when the law itself says that subsidies are only through the state exchanges. Now, there's only 14 states and Washington, D.C. that have their own exchange. So according to Howbig, who has challenged this, those are the only states where subsidies should be available. But what that would mean, if the court rules for Howbig, it would mean that in 36 states there would be no premium subsidies, and for any of those folks who are on the federal exchange or healthcare.gov. What it would also mean is in those 36 states there would be no penalties and no mandates because the two are hinged together.
Now, it's been said that the outcome of this case could actually potentially unravel Obamacare. Do you think that's a real likelihood?
Yes. Well, when you think about the law playing out versus the law on the books, it's not going to take law off the books. It's going to still be there. But the fact of the matter is, if people do not get premium subsidies, most of them are going to look at the full cost of Obamacare priced premiums, and they're going to say, well, I can't afford that. Many of the people who are getting subsidies today are paying only $50 to $100 per month. If they have to suddenly pay $200 or $400 or $800 a month instead, they're going to choose not to enroll. And the exchanges and the coverage are all sort of the heart and soul of Obamacare. So if this does not work, is not happening, the law remains on the books, but is not functioning.
So I just want to make sure I understand what's happening here, because I don't want to get down in the weeds on this, Twila, but just to understand the simple concept. While subsidies are available in some areas, they are not available in others. Therefore, the law does not apply equitably. Is that the bone of contention essentially in this case?
No, the bone of contention is there is a clear writing of the law which says that the only place that you can get federal premium subsidies is through state-based exchanges. There are only 14 state-based exchanges. There should be only 14 states that are getting these premium subsidies. But the IRS, being concerned that this was going to cause Obamacare to unravel, decided to give premium subsidies in the other 36 states, thereby imposing the mandate and the penalties, because the two are hinged together. If there are no premium subsidies in your state, there's no mandate to purchase health insurance and no penalties for not doing so. If there are premium subsidies in your state, there are a mandate and the penalties. And so what Howbig says is this is harmful. They're not following the law in their state. They should not be having to worry about penalties and the mandates. But they are, because the IRS decided to go outside the law and make up their own law and say that there's subsidies everywhere.
Now, I know you've said that the level of care could really suffer here with physicians having to use, outdated types of medicine. It's not going to be, are we looking at more like concierge type medicine? Are we going to look at only the wealthy getting really good health care and the rest of us just having to suffer for what we can get?
I think what you need to look at is the difference between coverage and care. They are not the same. So there's a lot of people being covered through Obamacare and Medicaid today who don't actually have access to care because doctors are saying, I don't get paid enough to take you, so go find another doctor. What we really want is medicine that comes down to the pocketbook of individuals, and that really requires getting government and corporations, health plans out of most of healthcare expenses. Because if for most things that aren't catastrophic, so for routine and minor care, you should be paying cash. There should be none of this paperwork for insurance or for government, because then the cost would come down and everyone, including the uninsured, would find access to health care far more affordable. That's what's happening in the cash clinics that are starting around the country, or even the cash surgical centers. People find them affordable even though they're paying cash.
So, Twila, a couple of minutes remain, and your Back to the Future prescription is not having either government or big insurance get between a doctor and his patients, or maybe I'll amend that since you're an RN, get between a doctor, a nurse, and the patients.
That's correct. We actually have the 5C solution, which anyone can find on our website, cchfreedom.org. That 5C solution is cash, catastrophic coverage, charity, confidentiality, and compassionate care. And that last one, compassionate care, gets all the regulators and the bureaucrats and the corporate entities out between the patient and the doctor, therefore making it easier to pay the cash for care and upfront, and making insurance itself, the catastrophic coverage, less expensive.
And
but there will always be a need for charity.
And that C about catastrophic coverage is so important for people to remember. Insurance for those catastrophic events that can befall us at any stage of life, but also using cash to help keep down prices and return patients to really healthcare consumers. The notion of taking a look at pricing. Twila, again, the website where people can find more information.
They can find more information at cchfreedom.org, cchfreedom.org, and at the very top of that page is a sign up for our weekly e-news, which comes out every Wednesday.
And Twila Brase, as you are offering that internet address, we pulled up the website so our viewers got a good look at it, and they will visit that site, I'm sure. We want to thank you for taking time to visit with us today, and we'll continue to stay in touch as the debate on healthcare continues. Thanks so much.
Thanks so much.
Thank you so much.
Well, it's an interesting concept.
It really is. And you know, I like her idea because you're wondering what can we do to protect ourselves, and go to her website and she has some very good ideas.
We hope you'll do that, and we hope you'll avail yourselves of social media to tell us what you think about healthcare. Why don't you tweet us your comments at Newsmax TV, #America's Forum, or go to newsmaxtv.com/comment.